Claritin is an antihistamine that helps with symptoms like itching, runny nose, watery eyes, and sneezing that come from allergies like hay fever. It can also relieve itching from hives. Keep in mind that it doesn't prevent hives or serious allergic reactions. If your doctor has prescribed epinephrine for allergies, always have it with you. If you're using Claritin without a prescription, make sure to follow the instructions carefully and know when to talk to your doctor or pharmacist. And don't give Claritin to children younger than 6 unless the doctor says it's okay. When using over-the-counter Claritin, be sure to carefully read the directions on the package. If your doctor has prescribed Claritin for you, follow their instructions and the information on your prescription label. If you have any questions, consult your doctor or pharmacist. Take Claritin by mouth with or without food, as directed by your doctor or the product package, usually once or twice a day. Remove the tablet from its foil pack just before taking it and place the tablet on your tongue. It will dissolve quickly, and you can swallow the dissolved medication with or without water. The dosage of Claritin is based on your age, condition, and how you respond to the treatment. Do not increase your dose or take this drug more often than directed. Also, do not take more of this medication than recommended for your age. If your allergy symptoms do not improve after 3 days of treatment, or if your hives last more than 6 weeks, be sure to inform your doctor. Seek medical help right away if your condition worsens, or if you think you may be experiencing a serious medical problem, such as a very serious allergic reaction or anaphylaxis. If you experience any unusual effects from taking Claritin, it's important to contact your doctor or pharmacist right away. While it's rare to have a serious allergic reaction to this medication, it's crucial to seek medical help if you notice symptoms such as rash, swelling, severe dizziness, or trouble breathing. Remember that this is not a complete list of possible side effects, so if you notice anything else that concerns you, make sure to talk to your doctor or pharmacist. As for the best time to take Claritin, it's usually recommended to take it at the same time every day to help maintain a consistent level of the medication in your body. The daily dosage for adults is typically 1 tablet, 10 mg, once a day. And it's important to follow the dosage instructions on the package or as directed by your doctor. Keep in mind that this information may vary depending on individual circumstances, so always check with your healthcare provider for personalized advice. Before taking Claritin, make sure to inform your doctor or pharmacist about any allergies you may have, as well as any medical conditions such as kidney or liver disease. It's important to consult your doctor before using this medication to treat hives, and to seek immediate medical attention if you notice any unusual symptoms. If you have phenylketonuria, PKU, or any condition that requires you to limit your intake of aspartame, talk to your doctor about using Claritin safely, as it may contain this ingredient. It's important to note that older adults may be more sensitive to the side effects of Claritin, such as drowsiness or confusion, which can increase the risk of falling. If you are pregnant or breastfeeding, discuss the risks and benefits of taking this medication with your doctor before use. When taking Claritin, it's important to be aware of any potential drug interactions. This means that other medications or herbal products could affect how Claritin works, or may cause serious side effects. It's a good idea to keep a list of all the products you use and share it with your doctor and pharmacist. It's also important to not start, stop, or change the dosage of any medicines without your doctor's approval. It's important to note that loratadine, the active ingredient in Claritin, is very similar to desloratadine. It's advised not to use medications containing desloratadine while using loratadine. Additionally, if you are taking Claritin, it may interfere with certain lab tests, such as allergy skin testing, which could potentially cause false test results. It's important to make sure that lab personnel and all your doctors are aware that you are using this medication. As for the best way to take Claritin, it is typically recommended to take it at the same time each day, and it can be taken with or without food. It's also important to follow the dosage instructions provided by your doctor or on the product label. And if you have any concerns or questions about taking Claritin, it's best to consult with your healthcare provider for personalized advice. If someone has taken too much Claritin and is experiencing serious symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. You can call 911 or a poison control center for assistance. In the US, you can contact your local poison control center at 1-800-222-1222, and in Canada, you can call a provincial poison control center. Symptoms of an overdose may include severe drowsiness. If your doctor has prescribed Claritin for you, it is important not to share it with others. Claritin is used to relieve symptoms of allergies, such as sneezing, runny nose, and itchy or watery eyes. It is also used to relieve itching caused by hives. The usual dosage for adults and children 6 years and older is 1 tablet or 10 mg once daily. It is best to take Claritin at the same time every day, and it can be taken with or without food. If you forget to take a dose, take it as soon as you remember. If it's almost time for your next dose, just skip the missed one and take the next dose at your regular time. Don't take a double dose to make up for the missed one. When it comes to storing Claritin, it's important to follow the specific instructions on the package or ask your pharmacist for guidance. It's best to protect it from light and avoid storing it in the bathroom. And of course, always keep medications out of reach of children and pets. When it comes to disposing of Claritin, it's important to not flush it down the toilet or pour it into a drain unless specifically instructed to do so. Instead, make sure to properly discard any expired or unneeded product. If you're unsure about the best way to do this, consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.